Thanks for joining me today on Crossing the Chasm. I'm delighted to welcome Jillian Racoosin, who is the Executive Director of the Foundation for Social Connection and the Coalition to End Social Isolation and Loneliness. In her role, Julian is responsible for leading the direction of the Coalition and the Foundation's operations and programs focused on advancing social connection across the United States. Previously, Jillian led Enterprise Go-to-Go Market Strategy for Force Therapeutics, a leading healthcare technology company and care management platform. Focused on improving health outcomes, Jillian has partnered with several high-profile organizations, including leading healthcare systems, health plans, and federal agencies. Her passion for health promotion began at Tulane University's School of Public Health and Tropical Medicine and continued to flourish at Columbia University Mailman School of Public Health, where she received her master's degree. Jillian is passionate about projects that foster healthy behaviors within communities and envision a more inclusive future with universal access to the support needed to be socially engaged in society. On a personal level, I, of course, enjoyed listening and talking to Jillian. She has a perspective that I think is so important and really relates directly to the core of what this podcast is all about, which I'm really interested in, social connection. It's a fantastic conversation. I hope you enjoy it. Thanks for tuning in. Jillian Racoosin, welcome to Crossing the Chasm.
Thank you so much for having me. I'm so glad to be here.
Well, I'm delighted to be talking with you. You're the perfect guest for this podcast, and I'm excited to hear your thoughts today. As always, we start the show by just asking people about how they see their work as it relates to the chasm or chasms, and you're working on social isolation and loneliness. What do you see as the chasm or chasms in society?
Well, thank you so much, Brian, for the question. And I think all of us experience social isolation and loneliness, some more than others. And of course, really since the pandemic, we all have an understanding of how this can impact all of our lives. We've seen since the early 2000s rates of social isolation and loneliness rising. And that is across all ages. So not just for our older adults, but also for our school-age youth, for Gen Z and others. And so really what we've been focusing on is how can we move the needle forward in research, in advocacy, in innovative interventions to address social isolation and loneliness and build more socially connected communities across the country.
A lot there. I want to get to some of those issues about why we're experiencing those trends. But just to begin with, I'm really curious to hear your thoughts about the two words you're using, social isolation and loneliness. And I think most people would have some idea about that. But can you just explain what you mean by those terms?
Absolutely. So social isolation is the objective measure of having two relationships, maybe thinking about the number of relationships that you have in your life, or also the frequency in which you are connecting with others. And of course, loneliness is in the subjective measure. So really thinking about the feeling of that difference between the relationships you'd like to have and what you feel that you do have. So we really think about social isolation again as that objective count and really thinking about loneliness as a subjective feeling.
So I'm curious about this issue of social isolation because I think it's super interesting. Are you saying it's not subjective, it's objective in some respects, but how is it actually measured? Because if you're in society, if you're interacting with people, you can still feel lonely and isolated even if you're in proximity. So how is that actually assessed?
Great question. So there are many different validated tools to measure, loneliness as well as measuring social isolation. We actually, as a foundation and coalition, just worked on developing a proposal for NHANES, the National Health Survey, to add additional measures of social isolation, loneliness, and social support to make sure that we can continue to understand, the prevalence of these conditions across the country and changes over time. Social isolation, as we think specifically, we might ask questions, such as, how many close relationships do you have? How often are you going out and attending clubs or other sort of activities in your community? Are you able to access food, other, community support without needing, or, on your own basically, or are you engaging in those activities with other individuals? So really thinking about, objectively what a person is going through their daily life.
I'm wondering about, just personally, I feel quite lonely in society, and it varies from time to time. I guess I'm wondering, how do you assess people when their situations and their perceptions can change potentially on a day-to-day basis?
So another good question. I think the key there is thinking about point loneliness and then chronic loneliness, right? So of course, we all might feel lonely at any points of our life, and maybe that is short-term and acute, or maybe that's chronic loneliness. And really where we get into trouble in terms of cognitive decline, physical ailments, etc., is with that chronic isolation and loneliness. And so that's really what we're looking out for. I think, many psychologists and other experts will agree that acute loneliness is typical of being human, and also what helps us with our resiliency work as individuals. So really that chronic feeling of despair is what we're concerned about.
I was listening to an interview recently with the current Surgeon General who indicated that extreme loneliness can be worse than smoking 15 cigarettes per day. Is that true? And I guess I'm just curious if you could speak to the health consequences of loneliness, which we sometimes don't associate with poor health.
Yes, absolutely. So first of all, I just want to, thank Dr. Julianne Holt-Lundstad, who is our scientific chair, actually at the foundation, for her really foundational work in understanding the associated risks with, chronic loneliness and isolation and health outcomes. And that's where that 15 cigarettes a day, that statistic is coming from. And also Dr. Murthy, our U.S. Surgeon General, has been a wonderful champion of this work. And we're really grateful to have his support and his office's support in driving the movement forward. So I guess short answer is yes. We understand that as we look at the risks of chronic loneliness and isolation, and so associations with morbidity and mortality. And we look at the likeness of morbidity and mortality as it relates to smoking. That's where that connection is coming from, right? So as we're thinking about increase of mortality and morbidity is really, we're seeing worse outcomes than of smoking 15 cigarettes a day.
Why is that? What's the mechanism that leads to such poor health from social isolation and loneliness?
Yeah, so I'm not a scientist, and I'll be the first to admit that. And so Julianne is really wonderful, and our entire scientific advisory council is wonderful, and can help talk about the science of it. But really, it's pointing to the factors that are driving really high cortisol rates, thinking about how it changes, inflammation, blood pressure, our gene expression, neuroendocrine functioning. All of these things can be basically changed based on stress, depression, thinking about hopelessness, that might come with feelings of loneliness. And so it's really thinking about, the direct and indirect pathways by which the, social disconnection can influence disease, morbidity, and mortality.
So we know this is an emerging and serious public health concern. You mentioned earlier some trends. Can you just speak a little bit more about that? How have the trends in loneliness and social isolation changed, and why is it so prevalent today, do you think?
Yeah, thank you. So, we actually just came out recently with a report around, the intersection of social connection and education sector. We're actually looking sector by sector and developing key reports, understanding stakeholders, landscape of the evidence, and thinking through promising practices for intervention strategies. And in the education report, we saw, a stat that was school loneliness in the U.S. has increased almost 20% in the last 20 years. And a big piece of that happening, after 2012. And of course, we saw a big jump in their impact as many students were sent home to do school in the home during COVID. We saw from Cigna's recent work that Gen Z is reporting the loneliest generation in the high 70%, as well as millennials also reporting high loneliness. We know from some additional data from AARP and others that, 24% of older adults in the U.S. are considered to be socially isolated. And thinking about increase over time, adults with poor physical and mental health experience higher rates, and some rates increasing, even over the last 5 years. So this is really all trending, upwards into the right, which is not what we want. We want to think about how can we make sure that we're addressing each of these key population segments with interventions that make the most sense for them, and tailored interventions, I should say, so that we can address this and move those trends down.
And I want to get to those interventions in a minute, but I do want to linger here a bit on some of these questions around the drivers of these issues. The COVID situation and the pandemic clearly caused an issue, but this situation predates the pandemic. And I guess I'm still just curious what's going on. I did read some studies that suggested that people have far fewer friends. They have, they go over to people's house for dinner far fewer times. They're not as active in the public sphere in terms of voting and community volunteering. I guess I'm just curious from your work, do you have any sense about what is causing all of that? I mean, there's some obvious drivers of that, but what do you point to?
Yeah, it's a big question. It's one that many people are trying to think through and thinking about the drivers of decline, and you pointed out a lot of them. You can see that our nation is becoming more divisive. You can see that people are less involved in clubs and groups than ever before, not looking to places of faith to participate in or to go to for community as much as we've seen in the past. I think some might say it's easy to claim to put the onus on individuals, but we really want to drive systemic change. Thinking about how can sectors of society come together from a systems, policy, and environmental, lever to really enact that change. So thinking about our schools, our parks, our faith, communities. How can each of those be a player in turning this around? And so I know it's not a direct answer to the question. I think you pointed out a lot of the challenges that we're facing. And I think really the next step is thinking through, how can we be rebuilding at the community level? A lot of the work recently has been done over the last, 15 years or so on the individual. Well, every individual is different. They're going to come to interventions differently. How can we start to invest more in the community to think through creating welcoming spaces that people can feel like they belong?
Is this just a U.S. problem, or is this a trend across the globe?
Unfortunately, it's not. It's a trend that we're seeing across the globe. We are also a part of the Global Initiative on Loneliness and Connection, the foundation and coalition that is the U.S. members. And that's a consortium of about 15 countries, different, similarly situated organizations in each of those countries. And we are, working really closely with our global partners to understand what is happening in those countries, what is the avenue that they're taking to enact change, and some of the work that they're leading. We know that the UK and Japan have been, extremely forward-thinking in the appointment of ministers of loneliness. We know that the WHO and the UN are working on developing a commission on social connection and thinking about an international scientific board so that we can bring, the great minds around social connection together and really work together to solve this problem.
So this is by any measure a public health crisis. Do you think it's being taken at that level? Do you think most people see loneliness or associate loneliness with a public health problem? Or is this a problem that remains kind of obscured in public culture?
Our goal is to get there. Absolutely. I think we're at the precipice of something really big. I think, of course, as you mentioned, loneliness and isolation has been a problem people have been facing for a long time, even before the pandemic. But, it really woke the world up to understanding what it feels like to be alone. And I mean, socially isolated and to have those intense feelings of loneliness, of not being able to be out in society. We've been working really closely with our federal partners as well as our local partners to think through how can we continue to bring awareness to the issue and really think of it as a public health priority. I know I mentioned Dr. Julianne Holt-Lundstad. She released an article, last year, talking about why social connection should be thought of as a public health priority. I'm happy to share that with your listeners. I think it's really critical for us to be thinking about, just like obesity, just like other public health issues, what are the guidelines that we should be developing that we can set forward for our nation, for our localities? And what are the toolkits that we can provide local leaders to enact those strategies? So those are the things that we're thinking of in order to make this more of a priority, on the docket of what leaders are working on.
Well, that'd be fantastic. I'd love to get that article. I am curious, just personally, I know that men are more likely to be lonely in our society than women, at least in the US. And I think that's interesting in and of itself. But I'm also wondering, are there other demographics that experience loneliness that we're not thinking about that also need a lot of attention and addressing?
Absolutely. Unfortunately, it's a lot of similar communities that we see are hurt by other conditions, those that have lower socioeconomic status. We see individuals who have disabilities or chronic physical and mental health conditions, caregivers. We're seeing new moms and parents as a key group that's emerging, veterans, immigrant communities, those that might live in rural areas or far from others, and in children, adolescents, those who have weaker family structures and support or don't feel like they have that belongingness at school. So, but we are really seeing that, encapsulates many, many different people, LGBTQ plus and others that might have more challenges feeling that feeling of belonging in their communities, that we want to make sure that we're thinking through how to adjust and support those communities specifically.
Is this situation sort of making it into the public sphere? I mean, are there examples you could point to in like television or movies where social isolation and loneliness are being portrayed in ways that are bringing this to more and more people?
That's a great question. One thing I'll say is a positive trend we're seeing is a lot of intervention work focused on intergenerational connection. So young people and old people, or people from many different generations. And I think we are seeing this a lot more in media and television and movies. We work with an organization, and, Eunice Nichols, who leads that organization, brought up, the show Hacks. It's a show, I don't know if you've seen it. It's about an older comedian and a younger writer and kind of their life on the road. And I think, thinking about how connections might be, maybe brought to light in new and different ways, and thinking perhaps even just outside your own friend group or your community, and how you can bridge connection with others that might be or think differently than you. So I'll have to keep thinking about some of the other, more socially connected or movies showing this connection. But I will say that, of course, at the heart of many of film and television, books, et cetera, are relationships. And, we really think about social connection as being that continuum of quality, functional, and structural relationships, right? So what are the structure of the relationships in my life? Do I have a mom, a dad? Do I have a doctor, another friend, etc.? Do I have, what functions those relationships serve for me? And then what is the quality of those relationships? And is it positive or negative? And each of those components are going to play a role in my social connectedness.
Yeah, and thank you for the recommendation. I think it's interesting because I do see a lot of films that really showcase isolation, but I'm not sure that people are sort of putting that together with the public health crisis we're currently in. But thank you for that. And thank you also for the work. I mean, this has been a nice introduction to just the problems and the severity of the issue. You're speaking very authoritatively. I'm really excited now to shift a little bit and to think about what we can do about all of this. But to start, I would really be curious. You've used the term connection many times. How do you think about that term? What does it mean? How should we think about it?
Yeah, for us, we really think about, I know I just said, thinking about it along a continuum, the extent to which one feels, socially connected depends on, their connections to others through, existence of relationships, a sense of connection that results from, perceived support or inclusion. And then, that quality piece, the positive and negative aspects of social relationships. And that could be, marital quality, relationship strain, again, that social inclusion or exclusion that I mentioned prior. So that's really how we think about social connection. And as we think about it more as it relates to communities, I think that's where we bring in the additional sectors and thinking through how are sectors enabling connection from a system, environment, and policy level.
So I've been interested in this topic of connection for a long time. And personally, I've been trying to find connection. It's actually quite difficult. I've been finding personally, and I think others as well, based on the evidence. How can people find connection? Because I think I heard you say earlier that it's not necessarily just an individual issue. It's not just, I'm not looking hard enough. It's that it's societal in some ways. So if it's not up to the individual, how can we move forward with social connection if it's not clear what an individual should do?
Mm-hmm. Mm-hmm. Yeah, and we really stand by that. We believe that social isolation is not a personal choice or individual problem, but it's really one that's rooted in community design and social norms and systemic injustices. And so that's why we tried to take a systemic approach in thinking through solutions and strategies. We've worked really closely with an organization called Healthy Places by Design, which released a report called Socially Connected Communities and talks about, what are the strategies for public spaces, for transportation, for housing, for community-led solutions that they can, employ to create more socially connected communities. I think that as we think about individuals taking the, control of their own, health and well-being, I think it's really that self-reflection of what piece are they missing in that continuum, right? And maybe that's with the help of a supporter, but thinking through, is it really the, the structural piece? Is it the functional piece, or is it the quality piece? Or maybe it's more than one. And then thinking about the interventions that, fit that best. We've seen some great individual level interventions such as, volunteerism, thinking about CBT and other mindfulness and therapeutic, interventions. But we've also seen a lot of great work happening with interpersonally in terms of peer-to-peer relationship building, support groups, clubs, etc. And then also thinking through more on an organizational level, how can workplaces and schools be thinking about developing policies and systems for connection, really to make it a more welcoming and inviting space.
So you've just mentioned a bunch of really interesting interventions, and you've used these terms strategies and solutions. I'm wondering, can you speak to a couple of specific examples, either a city or a community or a workplace? How do they move this forward to create the kind of space that people can feel connected in?
Absolutely. Yeah. So, I think a lot of the strategies are things that are going to sound familiar to people because we don't believe that needs to be starting from scratch. We believe that you can utilize existing practices and programs and just build off of those with the intentionality around social connection. So, for example, creating or developing a referral system for local hospitals to help patients access social connection resources. Likely, your local hospital already has a referral system as it relates to other SDOH, social determinants of health, indicators, or even other community supports. but why can't we think about something more specific for social connection resources and making sure that there is, a range of options for people to reach out to, and so that their providers can help them connect them to the help that they need. That's one example. Another might be around, passing a law allowing residents to plant community gardens in vacant lots. We've seen a big uptake in community gardens and, open streets for walking and things like that coming out of COVID and even before then, but really creating spaces in the community that are open, that are accessible, that allow people to see each other and be with each other, we think is really critical. And I think, as we think about schools, we're working with a couple different organizations now that are creating and have created curriculum for schools around social connection. I'm thinking about reducing stigma, even with just talking about it at school, and thinking about how to engage students in, one of our partners, Beyond Differences, has No Kid Eats Alone Day. How can we make sure that we're engaging students so that they're leading the charge on those efforts as well? So those are just some initial examples.
No, those are all fantastic examples. I think what I'm hearing from you is that there has to be a lot of interventions. And so it seems like a lot of things have to happen in any given community to really overcome this social problem and public health problem. Do you have any examples of a place that has done this sort of in a way that intersects? So there's a lot of different things going on at the same time that's kind of a model for other places? Or is this just still emerging as a response and solutions are coming sort of slowly?
Yeah, so I would say that there are many communities already doing incredible work. I think the coordination is a piece that, we're thinking through how to, best support. We are actually working on a project right now, building toolkits I mentioned a little bit earlier for local leaders, and those could be formal or informal. Those, might be mayors, city council people, business owners, community-based organization leaders, to provide them with the tools they need to deploy strategies for social connection. And we're going on a bit of a roadshow, learning from different communities around the country in, what does social connection mean for their community? What does their community context look like and feel like? And what are the solutions that we can prototype and co-develop? And then thinking from those conversations, how can we build the tools to support them and the sustainability of those initiatives? So I think there's a lot of great work happening. I think it's more around the coordination, and our biggest, suggestion or encouragement there is to create local coalitions. We, as the Coalition to End Social Isolation and Loneliness, work on a national level with many different organizations, but we also have many local coalition partners. Northern California, for example, Texas is another example. Connecticut's doing great work. Massachusetts Task Force. So we know that there are localities also focusing on how can we bring together, coordinate, and elevate the work so that we can, help our constituents best.
So if you were to talk to just a regular community member in any given community, and they were interested in all of this, what would you tell them about how they can contribute to this process, this coalition work? What can they do?
Great question. Well, I will say, firstly, if someone's looking for resources, findhelp.com, also ARP and Commit to Connect have great resources online for individuals to look for things in their own zip codes. We also have a lot of resources on our own website. So I asked individuals to please go there and look for different supports in the community. In terms of getting involved, we have our policy agenda was just released this week, our 2023-2024. And of course, that's for our federal advocacy work. But we also work with a lot of local leaders and partners to think through how can we advocate on a more local or state level. We have our Global Loneliness Awareness Week work happening in June. June 12th to the 16th is Global Loneliness Awareness Week. We'll be hosting an activation at the Capitol, but also many different organizations and individuals are hosting events in their own communities. So I would, challenge them to think through what's an event. It could be as small as hosting a community dinner a potluck or, maybe volunteering with a friend that they can do during Global Loneliness Awareness Week to really activate around the important time of year where we're really focused on committing to action. So those would be some initial recommendations.
Yeah, no, that's helpful. And we'll post some things on the website that you can provide for us, for our listeners. So thank you for that. I guess I want to ask you personally, are you lonely?
Yeah. So, it's funny. I always share when people ask how I got involved in this work. When the pandemic hit, I was living in 500 square feet in a big city by myself, working in the same space that I was sleeping, I was working out, I was doing all the things about life. It was not the first time, but it was a time where I felt very chronically lonely. And, I felt like I have a great support system, great friends, great family, but I was still feeling this way. And I wanted to, and I had the thought that of course there are many others that are likely experiencing the same thing. So that's one thing. I also have, two amazing grandparents who are in their mid 80s and they live, in a beautiful home, but they are now pretty homebound. And so I'm seeing sort of understanding for the first time the challenges that they're experiencing with feeling very removed from life and working to think through how I can make sure and our family can make sure that we're keeping them connected to our lives and to, the world outside of their home so that they feel that real sense of belonging and also social connection so they don't fall into that isolating feeling.
I appreciate you sharing that. Thank you so much. I guess I also wanted to ask, related to all of this, is there a stigma associated with being lonely or socially isolated?
Absolutely. I think, unfortunately, there is. I think what I will say is I really commend Gen Z and our younger generations for being so open about talking about mental health. For me, I personally have had mental health, conditions and struggles through my life that I have felt very confident and comfortable talking about. But I know for many others that it's a challenge. And for me, it's a privilege that I feel like I can talk about it openly. And for others, I know that they don't have that same privilege. And so I do commend the younger generations. I think are talking about it a lot more in public spaces, are much more comfortable talking about what's going on, with their mental and physical selves. And I do see that our trend is towards a more open, holistic well-being, notion of being a human, and that has many different components. And there might be good days, there might be bad days, there might be, bad, weeks or months, and those are okay to talk about.
I guess I wanted to ask you a question because I think, we have this hyper focus on individuality in our society that's at the core of our Constitution and so forth. And so what do you say to people who just argue that, we're just a disaggregated society and that there's just always going to be isolation and loneliness as a byproduct of having, individual freedoms?
It's a hard one. I mean, my response would be that I believe the human condition includes connection and that we need connection to live and to thrive. And I believe that it might look different for different people, of course, what that level or continuum looks like for them. But for each of us at our, as we look at our basic needs, connection is one of them. And I think it'll always be there. And that's why, we didn't really get into the digital components, but, it's wonderful what technology can do for us, but we don't want to view it as a replacement for in-person connection. And I do see a place for us to have, face-to-face, to have hands holding hands, to really be sharing stories with each other for the foreseeable future.
Yeah, and I appreciate you bringing that up because one of the main contributing factors that many people point to isolation is technology. And that's Netflix, but it's also staring at your phone all day. instead of connecting with people. I guess that raises some other questions about just our society. Can we have basically the same configuration of our society and increase connection, or do we need to really change what we mean by society and community?
I think our components are there. We have amazing community leaders. We have community-based organizations doing great work. I think it comes down to the awareness, to having the building blocks of how to approach this systematically, and also investment, right? And that means from public funds, from private funds, corporations, thinking through how can they all play a role in driving the movement forward. So I think the pieces are there. It's just about putting them together.
I have three last questions that are sort of personal, but before I ask that, I have one last question to put you on the spot to ask a question that's really unanswerable. But that is, if you could make any decisions, if you had total control and could change things, what are some of the top things you would do immediately to address this problem of social isolation and loneliness, to create connection? What would be the interventions that you would prioritize as the most important?
There's so many. Well, this goes, one, I'll say goes a little bit against what we were just saying, but universal broadband is something I think we absolutely need in this country. And, just because you can't get online, it shouldn't be a barrier for connection. So that's one thing. Two, I would say incorporating curriculum on social connection in schools and talking about this from a very young age and normalizing feelings of loneliness and isolation, and thinking through how we can continue the conversation with young leaders around this work and all young people. And I guess I would say the last piece is thinking through how we can continue to drive funds to community-based organizations that are serving older adults in their homes, such as Meals on Wheels or other amazing community supports that have been doing this great work for a very long time on shoestring budgets and really are thinking through how they can best support their own communities. So I would say those are some key things. Of course, from the policy perspective, all of that drives up to thinking about what is a nationally coordinating body that can take this on in the United States. Is there an agency that can be sort of tasked with owning this work and really being held responsible for driving it forward? Can we add those measures of isolation, loneliness, and social support to our national surveys so that we can actually track the great work that's going on and how rates are improving over time? And can we continue to pilot new interventions for key segments of the population that are feeling this most?
Oh, that's fantastic. Thank you so much. I appreciate that. You're obviously an expert and very passionate. We appreciate that. I just want to end on some personal questions. And I want to start by asking you, what do you see in society that gives you inspiration and energy?
Yeah, I think for me, the biggest is being able to talk to all of our partners, day in and day out. I see an incredible community of individuals and organizations that are focused on addressing this problem. And that ranges again from large nonprofit, for-profit, thinking through local small institutions, across the board, cross-sector. They all want to play a role in addressing this and creating a better space for us to connect. And so I think the key thing is just feeling like there is so much activity and passion for creating a better future, a more socially connected future for all.
Do you have any examples of something you've read or heard or listened to or seen recently that has made you think in new ways or more deeply about the work you do?
So many things. One that continues to stick with me is something that, many people have been working on this term, but recently it was used in a the Equitable Long-Term Recovery and Resiliency Plan. It's a government working group focused on post-COVID resiliency. And they have a framework, the 7 vital conditions of living. And in the center is, civic muscle and belonging, or civic muscle and, and belonging. And one of the terms that they use throughout is this idea of a multi-solver, of something that can solve more than one and address more than one issue in society. And it really has changed my perspective of how we can continue to think about addressing social isolation and loneliness from a systemic lens. There's already great work happening in investment in housing and education and other spaces. So how can we use those strategies in thinking about multi-solving for social connection as well?
And then lastly, I'm just curious, this can be overwhelming, a lot of difficult challenges and problems. What do you do in your own personal life that brings you joy and gives you a sense of joy and pleasure?
Yeah, so, I feel very fortunate to lead these 2 organizations and have an incredible team. I also am a fitness instructor, which is something I've been doing for almost 10 years now. It's just a personal passion of mine is health and well-being. And, in college, when I was looking to make some additional money on the side, I thought, let me take a training in how to be a group fitness instructor. The rest is history. I've taught in probably 5 different cities around the country. And now I get to work with people on a daily basis and think through how I can make them feel strong, more empowered, and just ready to take on their day. So it brings me lots of joy.
Well, I'm delighted to hear that. And I really appreciate you sharing. And thank you so much for coming on the show. This has been just a fantastic conversation. I learned a lot, and I really appreciate you making the time. Thank you so much.
Absolutely. Thank you so much, Brian, for having me. I hope you have a good rest of your day.
What a fantastic conversation. I am just ecstatic that we had the opportunity to talk to Jillian. She is such a force in the world of social connection and overcoming loneliness and isolation. I really respect her work and really enjoyed talking with her. As always, I want to thank you all for listening. Really appreciate it. And thanks to Daniel Phillips and Cody Bayless and Chris Flores as the executive producers. And thanks, as always, to Anodyne Diversion for the music. Really appreciate you tuning in. I hope you can listen again. Take care.